Healthcare reform is an emotionally charged issue. Violent outbursts could be witnessed at town hall meetings with President Obama over this very subject. We thought it would be interesting to ask healthcare providers what they would do to improve healthcare. Who would have a better knowledge base than the nurses, therapists, and doctors that see patients every day and deal with the bureaucratic nightmare that is now medicine?
What do I think is wrong with healthcare? It's where do I start? Probably a couple of things jump out at me the most. One of them is there's so much talk now about the underinsured, the people that don't have insurance. And in my work, I see so many of those people that have made a conscious choice to not have insurance. There are some that have that option available to them, and they opt not to take it. And then when they get ill, they're upset because nobody will pick them up then. That's an issue that I think needs to be dealt with. The other thing that I see I'm not really convinced is helping us a lot is computerized charting. Everything that you have, it has to be something that's pre-entered into a computer. And if you have a patient that doesn't fit any of those neat little categories, then you have to choose one anyway. And sometimes that doesn't accurately represent what's wrong with that patient, and therefore doesn't represent what the best course of treatment will be. But there really aren't any other options as long as you're tied to that computer. And I think that's becoming more and more of an issue as we switch more and more to computers.
It was evident while collecting opinions that these providers echoed the same sentiment over and over. The two main repeated themes were improper use of health services and the uncontrollable abuse of power that insurance companies hold.
I definitely think that the public option would encourage healthcare insurance companies to be competitive, lower their prices, and allow it for everybody. Healthcare should not be a commodity. I see patients every day that have to make a decision. Do I buy my inhalers or do I pay my rent? Do I go to see my doctor or do I buy food for the month? That is what we need to do, is start focusing on true health care, not so much sickness care.
Ask yourself these questions. Is healthcare a right, a privilege, or a commodity that can command unlimited profit?
So the question is, what would I do to change medicine? It feels like, from an emergency medicine standpoint, that medicine has become a discounted service with little value by the patients and the payers. Recently, I bought a take and bake pizza from Papa Murphy's. I spent $25 or $30 for one pizza. The next woman walks up with her debit card for food stamps, gets two pizzas. I get paid $15.65 to see a Medicaid patient. The food stamp recipient goes to Papa Murphy's, spends 3 times that on one take and bake pizza. And Papa Murphy's does not take a discount. They get paid full price. I charge Medicaid $100, I get paid $15. So as far as universal health care goes, we already have it. I'm required by law to see every patient who presents to the emergency department and give them a medical screening exam. And it's just as easy to give them a medical screening exam and treat them as to just screen them and not treat them. I would feel more comfortable and happier actually getting paid at least 25 cents for every dollar I bill out of every patient than none out of half my patients, 85 cents from the next patient, and $1.50 from the third patient.
Of all the patients that we saw yesterday, 160-some patients, less than 20 of them were self-paid, which we'll probably get no money out of.
Or full price.
The others were insured or Medicaid, which we will take whatever percentage that we're allowed to take.